Hi, I'm Jeff Holden. Welcome to the Nonprofit Podcast Network. Our purpose and passion is to highlight a nonprofit organization in each weekly episode, giving that organization an opportunity to tell their story in their words to better inform and educate the respective communities they serve, as well as provide one more tool for them to share their message to constituents and donors. Our goal is to help build stronger communities through shared voices and to both encourage and support the growth of local nonprofit organizations through podcasting. Thanks to our founding partners for their foresight in helping us transform the way conversations start. CapTrust, fiduciary advice for endowments and foundations. Runyon Saltzman Incorporated, RSE, marketing, advertising, and public relations creating integrated communications committed to improving lives. And Western Health Advantage, a full-service healthcare plan for individuals, employer groups, and families. This episode on the Nonprofit Podcast Network is one unlike any other. We're all familiar with the plight of our homeless population. There's a very hidden, dark side to being sick and homeless, and that is what happens when one becomes terminally ill. The disease is irrelevant, the outcome is the same. To die in squalor, on the streets, alone, is inhumane. We're told it's one of the biggest fears a homeless individual has. We're going to hear firsthand the very personal story of a journey that is emotionally difficult in many ways, is incredibly inspiring in others, and is the epitome of conviction, determination, and perseverance. It's the spirit and love for her grandson that prompted Dr. Marlene Fitzwater to embark on her journey to build Joshua's House, a hospice home providing dignity to the terminally ill homeless. Marlene Fitzwater, welcome to the Nonprofit Podcast Network.
Thank you.
We are so excited to have you. You have an absolutely incredible resume and the contributions you've made in so many ways, and you're still continuing to invest in our community. This is just going to be a great conversation. I can't wait to get into the elements of it. The Health Commission Research Institute, you founded that back in 1989.
Right. Mm-hmm.
Can you give us just kind of a high level what that was? It's still
Right.
active.
And it's the Health Communication Research Institute. And it was focusing originally on communicating with populations that are sometimes hard to communicate with around healthcare disparities, healthcare issues. And we've done over the years a number of projects with a number of different populations, including American Indian tribes, the Black population around cancer. So a number of different populations. We also did a whole series on pain management when that was an issue, and developed educational programs for physicians in working with patients who have pain. And so we've had a variety of different projects, but it's a nonprofit. It's always been about delivering information and education to as many people as we could about healthcare issues.
And in its iteration today, what is it? What purpose is it serving today? Is it the envelope for Joshua's House?
Well, it still has its basic mission and vision, which is improving communication to address disparities. And so one of the disparities we discovered a few years ago was the homeless population. And so that's its focus right now. And so we do a number of things besides Joshua's House. We also, again, do a lot of educational programs for physicians, for interns, and social work students, nursing students. So we're still doing what we were doing, but with a little different focus, and our focus is on the homeless.
Boy, I can't imagine where you find the energy and time to juggle all the pieces. And almost a general contractor the last 6-7 years.
Yes. That's been a whole new trend for me. Yes. And so I had a lot to learn when we made a decision to try to create a place for the terminally ill homeless to go, because a lot of people don't understand that if you're terminally ill and homeless, you don't have access to hospice.
Mm-hmm.
And we know over the years the importance and significance of hospice care. But if you don't have a home, you don't get
Right.
hospice. And so that's been our focus for the last 7 years is creating a facility, some sort of facility or community where terminally ill homeless folks can be discharged by their health system or hospital to Joshua's house and then be provided with hospice care through their hospital and their health care.
Mm-hmm.
And we provide everything else. So we would provide comfort care, clothing, meals, um, trained hospice volunteers. We even have at Joshua's house the first trained and certified end of life doulas,
Mm.
which is taking the doula concept and serving people who are terminally ill if they want someone more close to them and more frequent. They can stay with a patient 24 hours, and so we've added some things to hospice care that didn't exist before. But that's our focus now.
And let me ask you how we got there because it came almost through a circuitous route
Yes,
to end up in this situation of serving the homeless. And it really isn't about just oncology or cancer, it's any disease that they may be suffering from that they're terminal.
exactly.
But something near and dear to you caused this. Would you explain that to us?
Yes, and I hope I can do it without crying.
It's okay, we
um,
understand.
I had a I had a grandson, Joshua, who I was in the delivery room when he was born
Mhm.
and helped babysit him and take care of him when he was little. And as he got older, we kind of drifted apart, and so I didn't have contact with him for several years. And then he reached out, and we reconnected. And I at that time he was homeless. He was a young adult, and he was homeless because he had developed a drug addiction. And but he was the smartest kid and the greatest. He was a poet, he was a musician, he played the guitar beautifully, he sang, wonderful songs, very creative and imaginative, and this is kind of unique in that instead of calling each other all the time, he wrote these incredible letters. Nobody writes letters anymore.
Right.
And he wrote and would put in a art piece or a poem or something, and so we just started, and he was kind of in and out of jail and, things happen, but we wrote to each other all the time and shared things, and he started sharing stories about other homeless people that he would encounter, and, um, and so I became kind of interested in this homeless population because I learned that I think a lot of people think they're all pretty much either addicts or alcoholics and just have never tried to do anything other than that.
Mhm.
And what I learned from Josh, and then later from my own interviewing over 200 homeless people, the majority of people who are homeless got that way because usually it's because of a bankruptcy or somehow they lost their home or lost their job. Something happened, a spouse died, and they became homeless. And once you're homeless, it's really hard to get out of that. And so I just learned a whole lot more about that situation. And and then he started telling me about people he met who were terminally ill. They'd gone in to the ER and they were diagnosed as terminally ill with usually only a month or two left to live, and they had nowhere to go. So initially, we were just talking about housing people, how we could help do that. And then because, as I said, earlier in my life, many years ago, I when I first came to Sacramento to accept a position at Sac State, I started the Sacramento Hospice Association because my doctoral dissertation was about death and dying. And I started the Hospice Association here and was involved in that and had patients that I was their hospice volunteer. But then I'd gone on to other things since then, so that was sort of just, something that happened back then, and I realized in talking to Josh that that's what they needed. They needed hospice care. to help relieve their pain and to help relieve the suffering.
Well,
And
and to
and
give them some dignity too,
yes.
because what a horrible situation to be suffering and dying like that alone.
Well, I interviewed, almost it was 197, I think now, homeless folks.
200 works.
And every single one, regardless of their age, and these were from 18 to 67, regardless of their age, their biggest fear, I would ask them finally at the end after talking about their health care and their how they were doing and their housing need and so forth. I would ask them, what is your biggest fear or concern?" And every single one of them said, "To be sick and to die alone on the street." And that was a fear they lived with because they were homeless and they
Mhm.
didn't see in the future ever having a home. And so that really stuck with me that we had to provide dignity and love. And then as I got into it, we needed to provide hospice care.
Yeah, dignity and love only goes so far when you have no place to provide
Or
it.
you're in extreme pain.
Right.
I had cancer, cervical cancer, and almost died, and I know the pain of the last
Mhm.
days of that I didn't die, obviously, but,
Right. And we're
as
very grateful for that.
I am very grateful for that. Um, so, yeah, there's a lot of pain control and just comfort and decent meals and volunteers who can do things for you, like write letters or read to you or play cards with you or something. And so that really became the dream and the hope and the vision for Joshua's house.
And it's interesting, you were already going down that path prior to Josh's passing.
Yes.
And then what was the catalyst there?
He died of an overdose on the streets of Omaha, Nebraska in 2014. And so, that's when I made the commitment that I was going to create Joshua's house
Mhm.
in his memory, and that's what's kept me going. I mean, I can't tell you how many challenges and problems there have been, but every single time it was going back to for me to go back to that, how much I loved him and cared about him and how horrible that was. So, yeah,
How beautiful you can build this legacy, though,
yeah.
and that you started it together.
Yes,
You know, it
yes,
was it was something that was born out of a conversation between you
yes.
with that understanding of compassion and dignity and love for the homeless.
Right.
What brought you to the genesis of, "I'm gonna build this house now in Sacramento," because that's a lot of work. That's not communications, that's
That's
actually
a lot of
construction.
work.
It's a different sea, which is a lot harder to
Exactly.
deal with.
So I had to learn a lot
I
about,
can only imagine.
and some of the lessons I learned, I didn't know. I have 4 sons, and 3 of them live in Salt Lake, 1 lives here, and, 2 of the one's in law enforcement, but the others are all involved in some way with building,
Mhm.
cabinet building or building, and I didn't know, nor did they, that California has the most permits and inspections of any state.
Yeah, we might call that restrictive building process, right?
Well, that and it's very expensive.
Right.
I'm realizing it'll have cost me, probably a little over $100,000 just for
Just in
permits and
permits.
inspections, which I hadn't budgeted, I didn't think about, I didn't know you needed that. Um, so I've learned a lot about that. I've learned a lot about work that contractors do and subcontractors do, who does what. I mean, all of that, and
Mhm.
how to negotiate a decent agreement with folks to do the work. So I've learned a lot about, I hope I don't ever have to do this again, but I've learned a lot about the building industry.
Well, we're gonna talk about the expansion at some point. That comes up in a question
Right,
here,
right.
so we'll be looking at that. I think the sad part that people don't realize is Sacramento in the latest survey was roughly 6,500, 7,000 homeless people. 20 to 25% will die on the streets.
Right.
It's an amazing number when you
That
think that that's
is.
1,600 people who will pass on our
Exactly.
streets, and I think last year I saw a stat from you were on the website for 190 people passed away in Sacramento on the street.
Right.
And that's just not right.
No,
I
it's
mean,
not.
it's just not right. So you've got the project started. Tell us a little bit about what's happening. Where is it? What's going on with it? And we'll get into some of the details of the operation in a second.
Okay. Well, we started, about 7 years ago with a building on North C Street, and it's an incredible I fell in love with that building the moment I saw it.
It's
Uh,
hard for a lot of people to say you fell in love with a building on C Street.
I know, but it's an incredible building, and so it was for sale,
Uh-huh.
and, also at the same time, the, women's roller skating group rented it for a little over 4,000 a month, and they used it for their use. On Saturday night, they did their roller skating
Uh-huh.
thing because it was just a big empty building. No, it wasn't broken down into segments or anything. It was
Mhm.
just a big empty building. And so, I was able to purchase it and, keep them there at roller skating and using it as we begin to develop
Nice to
it.
have a tenant as you're
Yes, it
working on
was
the
very
process.
nice because it covered my monthly payment.
Yeah.
And they were great to work with. And so, started with that building. And of course, it was almost 100 years old. And so there were a lot of issues about the structure and what would need to be done and all of that. So I had to bring in different architects and different people to look at everything. I have to also say that at the beginning of this, one of the first people I met with to support the project was Jeff Harris, who was a city councilman at the time. And I always tease him because I remember going in and sitting down in front of him and he having this very stern look like, okay, well, tell me what you want. I can tell you no, and we'll be done. And I started telling him about Joshua's house. And pretty soon I see tears in his eyes and it turns out that he had just had his mother move in with him and provide hospice care to her until she died, and he said, "I never thought about that if you're homeless, you can't have hospice care." It never occurred to him. Very aware of the homeless problem and
Mhm.
very concerned about it, but hadn't made that connection. And so from that point on, he was a huge supporter, and,
If that isn't testament to there are no coincidences,
I know, I
right?
know, I know. And the only reason I did it, there is an organization in Salt Lake City called The In Between, and they started a hospice house for the terminally ill homeless,
Mm.
um, probably a year before, and I learned a lot from them. I went there, I met with them, I got a lot of information, and kind of learned about what they did that worked and what they did that didn't. And one of the things they did that didn't work was they didn't meet with the city council, they didn't meet with the mayor, they didn't until they were ready to open, and then they went and presented it, and they didn't open for another year.
Ooh, and they had to carry all that expense.
Yes, and so I was like, "Okay, I'm gonna start there," and so I met with, Darrell Steinberg in November before he took office. I met with several of the city council members, and knew had them know about it and be supportive of it before
Mhm.
I actually moved forward. And so, I think that that was one of the issues, and then I'm trying to think if there were any other issues, but I think it was just as we went on and that building on North C Street was a historic site
On top of it.
on
Okay.
top of its age. And so that meant we couldn't do certain
Right.
things we had to do. So after about 2 years, it became really, really clear that we couldn't use that building. And so I'm going, okay, we've got this building. And 2 months before that, the roller skating group moved out.
Mm.
They got a building
There goes
donated
your
to them.
rent.
So it was like, oh my God, I have this debt and what are we going to do? And so I put it up for sale. And in 2 weeks, we sold it.
Wow.
It's still sitting there empty, but the people who bought it, I think their plan is to create a, kind of a kitchen thing that provides meals to restaurants. They've been in that process of developing that over the years.
Okay.
Um, but to have sold it in 2 weeks, and I lost only a total of about 200,000, so and then, the other thing that happened in meeting with, the city council and the mayor, I got introduced to, Nick Abdus, who is a land use attorney, incredible, incredible attorney, and he stepped up and volunteered, and I've had his legal services for all these years, and I
Wow.
can't tell you how many hours and how many issues he's dealt with. Amazing guy. Um, so it was like coincidence, yeah, that meet these people who became such key players in all of this. Um, so then we started looking for other property, and we really couldn't find anything that would work. And then I don't remember exactly. I think it was through Daryl Steinberg that the city got kind of involved with us looking for property,
Mhm.
and Jeff Harris said the city owns a little over an acre of property on just off of Northgate and on Larchwood Avenue that's been sitting there empty for years. And it's completely vacant. There's nothing on it. And we're going to lease it to you for 25 years, renewable for another 25 years at no rent. We just pay annual property tax.
Wow.
So we had to sign that agreement
Yes.
immediately. So we had the property, and then, Nick actually shared that they had just brought someone on his dad's property to help run their business, who they got it bought a trailer, and it was a beautiful trailer, and they put it on the property, and it worked really great. So he said, "Why don't we look at that?" So we looked at trailers, and then we decided manufactured homes would be better because we could have them manufactured ADA compliant
Mhm.
to help people who weren't mobile.
Sure. Well, especially in that state, if they're
Yeah,
coming in
yeah,
hospice already, they're not gonna be very mobile to begin
right,
with.
right. And so ended up connecting with a factory in Arizona that creates manufactured houses, and we're able to, over time, purchase 6 of them. And they're ADA compliant. They're 3-bedroom each, and they each have a kitchen, a laundry room, bathroom, living room, and dining area. And so everything that people need to live comfortably. The rooms are good size, and so we knew it would work. And so we purchased 6 of those. They've since been in storage, which I have to pay for every month, and insured, which I have to pay for. Um, so the longer this has taken, there's been that added
Well, you had
expense.
this unfortunate circumstance called COVID that got in the
That's
way
right,
of your
exactly,
process.
exactly. And as you know, California really shut everything down.
Right.
So, and so thank goodness the factory in Arizona has accommodated us by storing them safely and will transfer them here when the foundations are ready.
Okay.
So we finally, and then it was just all, as I mentioned, all the permits and inspections that have had to happen for everything because turned out the soil on the property wasn't sufficient. They've had to bring in new soil and then discovered that the sewer line and the water line in the street in front, where the front entrance will be, had not been placed properly by the city in years past. We had to correct that.
That's why that was such a big deal on the website. I didn't quite understand, but
Yeah,
I
it was,
saw
oh
that
my
video
god.
on the website. I'm
And it
wondering,
didn't have
what's the big deal about a water line and sewer line?
because it was going back and forth with the city about where it should be since it wasn't in the right place
Yeah.
and how to do it right so it could connect to the houses on the property. That took I don't know how many months. And then also discovered there were no manholes, so we had to have manholes created, which I didn't know they weren't just in supply somewhere. You actually have to have them manufactured.
Who knew, right?
So that whole process has taken forever. But now that's pretty much all done. There's still a little bit of finishing up on the property, and now we're ready to bring in a new contractor who will lay the cement for the drive-in and the sidewalk and all of that, and get ready to bring the houses in, get the
Mhm.
foundations ready and bring the houses in. So they're looking to kind of do all of this through the rest of October and November, and as I mentioned, open late November.
And as we speak, this is mid-October,
Right.
so you're maybe just a month away from this dream being realized
I'm hoping.
for real, for real.
For real, for real. Yes.
That's exciting.
It is exciting.
Yeah. I can only imagine over the 7-year process, you finally get to see it come to fruition. You got those water lines and the sewer lines, and now you're down to pads for the properties or for
Right.
the buildings, the
And
units themselves.
landscaping and fencing, we're gonna do wrought iron fencing around with a gate, lock gate,
Yeah.
that kind of thing. Because we also had some conflict from about 5 neighbors who kinda spread some
Mhm.
misinformation.
Your, number, I think that's 18 units or 18 bedrooms you would have? 6 units, 3
We'll
bedrooms?
have 15 bedrooms to start in
Okay.
the 6 homes. We're using one of the houses for offices and storage and training rooms.
Sure.
But the 5 houses each has 3, there'll be 15 bedrooms, but there is space on the property for 3 more ADA manufactured homes.
Okay.
And so the goal over the next few years is to get those added so we take up to 25.
See, you're already adding. I knew that was gonna happen.
Well, yeah.
As we look at the people you serve, are there any criteria you have for somebody to be eligible to get into the
Yes,
homes?
yes.
And share that,
Um,
please.
First of all, they have to be they could have mild mental health issues if they're on medication and take that. But if they're severely mentally ill, we don't have the capacity, and the hospitals don't have the capacity to care for them in the homes. And so there's some requirements for, and we worked for several years, 3 years, I think, with the healthcare systems. They help develop the eligibility so
Criteria
they
for it?
know what they can handle and what they can provide hospice care to. And so that's one, they, fairly mentally alert, mentally healthy. Um, they can't be alcoholic dependent or drug dependent. If they are, they can go through a detox and then come into Joshua's house, but they'd have to agree to do that.
Well,
Um,
that's a beautiful thing because then they're coming in clean and sober.
right, right. And no smoking in the houses. And pets. A lot of the homeless particularly have dogs.
Right.
And at first, we were trying to figure out how we could let them bring their dogs in with them and stay with them, but that just became a big issue health-wise and everything else. And so what we've done is partner with a nonprofit organization that will take the dog, housebreak them, train them, and place them in a loving home with an agreement that if the patient wants to see their dog, that they'll bring the dog to them to
How
visit
wonderful.
so they can come visit them. They just can't live there.
Do you have an idea on the expected average stay
We're
in the
we're
facility?
looking at right now, once they're diagnosed as terminally ill and they've been homeless for any length of time, they generally don't last longer than a month or
Oh,
2.
okay, shorter than I would have expected.
Yeah,
Okay.
yeah. I mean, just because they aren't, sometimes they're not getting regular treatment anyway, but because of living outside,
Right, they're
and
not
that
in good shape
number,
to
yeah,
begin
and that
with.
number goes up in the cold of winter and the heat of summer
Mhm.
because other issues come up.
We're going to hear more from Marlene on who she's worked with, who's helped her get this project complete, right after these messages from the people who make our program possible. I was in the media business for over 35 years and had the great privilege of working with Runyon Saltzman, RSE, Marketing, Advertising, and Public Relations. We collaborated on many different campaigns, but their commitment to the nonprofit sector hasn't changed since their founder, Gene Runyon, started the agency. Over many years and many campaigns, Runyon Saltzman has been committed to improving lives by tackling California's most challenging issues. Guided by research-informed strategies and insightful, creative solutions, RSE develops innovative communications campaigns that raise awareness, educate, and reduce stigma in diverse communities throughout our state and beyond. To learn more about RSE, visit rs-e.com.
Hello, this is Scott Thomas with Cap Trust in our Sacramento office. I specialize in working with local nonprofits and associations. Annually, we survey private and public nonprofit organizations across the country to better understand challenges they see in today's environment. In our more recent survey, we heard concerns about proper board governance, mission aligned investment, and how to implement alternative investments. If you would like a copy of the survey or to discuss your organization, look me up, Scott Thomas at captrust.com.
I'm thrilled to have Western Health Advantage partnering with us as they do so much to support so many nonprofit agencies in our community. As a truly local health plan, you'll find individual and family options, employer options, plans for CalPERS and Medicare Advantage. From medical services to pharmacy, health and wellness support, as well as behavioral health care, Western Health Advantage has a plan that fits what you need. As an employer, for profit or nonprofit business, individual or family, you can find more at westernhealth.com. As far as the people that you're collaborating with, you mentioned one already. That's great to hear. You have, an animal facility that's able to
Right.
work with the dogs or cats, whatever their pet might be. Who else do you collaborate? Who else has been instrumental and will continue to be instrumental in the project?
Well, I certainly think the hospitals and healthcare systems, they've been part of this since the beginning. And so they're certainly very much involved. It will save them an immense amount of money to have a place to place these
Well,
folks.
to keep
And
them out of the ER all the time.
exactly, exactly.
And are they
Uh,
volunteer or is it a paid service in some way, shape, or form?
well, volunteer in terms of the patient and Joshua's house and who provides that. But they can bill if the person has Medi-Cal. There's a way for them to bill Medi-Cal for
Hmm.
the care, but the care is provided regardless of what they have, what insurance or whatever they have.
That's wonderful. How about anybody else? Community organizations how do they, I don't think it's going to be an issue because once you exist, your capacity is so small. I think it's just going to be so obvious. You'll be full all the time. But how are people learning about you? Who's out there? Who else do you interface with? Is it law enforcement who sees people on the street? Uh,
Yes, very much, interact with a lot with law enforcement, interact a lot with, churches. A lot of churches
sure.
now are providing, beds for homeless people or meals for homeless people, so work a lot with the churches and the synagogues, work a lot with, community groups like Natomas, where we'll be located, with their chamber,
Hmm.
and, so doing everything from speaking and sharing information about Joshua's house, but also ways that they can volunteer and help if they're interested. They've also helped us with fundraising a lot. Um, we've also, and as I mentioned, the city and the city especially has been very helpful and very supportive, and the county has been really good about that. So, and then groups, a lot of the homeless now, sadly, are veterans. And so, working with vet groups and associations that help veterans, doing a lot with them. So it's pretty much any not almost any nonprofit that has anything to do with the
With the homeless,
homeless.
yeah.
We reach out and let them know, and how can we help you, and how you can help us, and
And
yeah.
that's certainly something we'll be doing too to make sure as we have them come through and sit in that chair to share, did you know about?
Yeah, that would be
In so many
great.
cases, it happens so often where somebody's not aware. We're like,
Exactly.
you didn't know? How did you not know that?
Right.
This is right in your wheelhouse.
Right. And Perry Communications Group,
Hmm.
has been kind of our marketing and PR folks, and they've, created a biweekly, e-newsletter. We've got almost 2,000
Oh,
subscribers,
fantastic.
to that, and so helps to get the word out, and also, I have to say, we just reached an agreement with SMUD, and they're providing all of their services free.
You're kidding.
Including once we open, they believe we'll qualify for a community-based program
Yes.
that we wouldn't have to pay extreme electric bills.
I can't tell you how many times we have somebody, again, in this seat. The organizations that come up, there are several that are every single time. SMUD's one of them, Rayleigh's is the other. We
Yeah,
just hear so many times, well, one of our big supporters in some way, shape, or form, not always monetarily,
right,
as in SMUD. It's not monetarily directly, but it certainly is on an expense side of things.
right. And
That's
they've covered, I mean, there obviously are huge costs of putting electricity into
right.
the site, and they've covered all of that.
That's
Um,
fantastic.
so they've been fantastic.
Tell me a little bit about the budgeting. What's the expected annual revenue expense of the operation that you anticipate at this
Well,
point?
let me tell you how it's going to work because at my age, I know I can't run Joshua's house.
Right.
And I would like to do a couple other things before I leave this
Well, we
planet.
still three more units have to get onto the
Well,
property,
yeah,
right?
I'll help with that. But and so once Joshua's house is completed and ready to open, I'm turning it over to YOLO Cares, which is probably one of the only nonprofit hospices in the area anymore. Um, and they've been around for over 30 years. Incredible organization. And the CEO, Craig, has been part of Joshua's house since day one.
Mhm.
He was on our board, he's been part of it. And as we've gotten to know each other, we've discovered our former paths. We've kind of gone along the same path. I was really active in the AIDS movement and the care for AIDS, and so was Craig in Chicago. And then he was brought here to head up YOLO Hospice. Now it's called YOLO Cares. But I'm turning it over. So they will operate it. They already have staff lined up, a CEO and a manager and nursing staff and everybody they need. They're anticipating a little over, I think, 200,000 a year to run it, but
Mhm.
they've already gotten money in place and grants in place to help cover that cost,
Fantastic. That's
so
great.
that they don't have to worry about it, at least from the beginning.
Right.
Um, and I know that people he's Craig's and I'm gonna be on their board as long as I wanna be, to be sure this is done the way I want it. But Craig and I have already had so many conversations, and we both really agree on the mission and vision and what we wanna do,
What a
so
perfect collaboration that turned out to
oh
be,
my
right?
god, it did. And it's one of those again that
Right.
how I met someone like that and how so I'm grateful. I'm very grateful. I one of my sons keeps saying, "Josh is up there working, mom."
Yes, he is. Well, he's getting to pull the strings from the
That's
top.
right.
The fundraising elements of it. Let's talk a little bit about that. And I'm gonna give you a vision piece first. If money wasn't an object, I know this is the fun part, right? What would that look like? What do you see it looking like?
Well, I know it wouldn't have taken 7 years.
This is true.
I'd probably be, younger. Um, it just would have saved a lot of heartbreak and working 10-hour days and, concern, and it would have happened faster. We would have opened faster. And we probably, if money was no concern, we'd probably have a bigger facility because we know the needs there.
Yes.
Um, so, yeah, I think it would be bigger and it would have happened sooner. We would have been open.
And I can see just from the story and the need that the opportunity is there if that funding continues, if there's an opportunity to continue, you get 3 and you can get that many on that property. What's the next parcel? Where does somebody else have one they would like to donate? It's a well cared for facility versus some of the other options that could happen in a particular neighborhood.
Right.
So what a big plus that is.
Yes.
And I'm sure it'll be nicely done in terms of its
It's gonna be
landscaping.
beautiful.
Right.
It's right across the street from a grade school. So we did have some pushback from the principal. And like I said, there have been about 5 neighbors who've done everything in their
Mhm.
power to prevent this from happening. But there's also been an incredible number of parents and grandparents of children in that school who've written wonderful letters about how their children want to be involved. They want to volunteer and bake
Taking the words
cookies,
right out of my mouth.
and they see that as such an opportunity for their children to learn about compassion and caring for each other.
Right.
And so that's been great. Um, so I think and I have met with people who've flown in from all over the United States who wanna create something like Joshua's house somewhere else, and I'm happy to give advice, to share plans, to do anything they need to help support that,
Mhm.
because we're gonna need a lot of these across the country unless we put every homeless person in a house.
Not gonna
Not
happen.
gonna happen.
How about greatest need today? You're just about to open. You have to do a little bit of anticipation on this one because you're not there yet. But what is the greatest need? Since we're talking to a lot of people with this concept through the podcast, what would you say?
Well, the greatest need right now, unfortunately, is about $1,000,000 to finish this up and get everything open. And then as we move forward, I think trained hospice volunteers will be immensely helpful, um, with more facilities or more trained end of life doulas. Because these people, their families aren't there for them. Even if
Mhm.
they and the majority of homeless people were born and raised in Sacramento. I know there's been some talk about, oh, people are coming in here from somewhere else, and I haven't seen that. The majority of people I've interviewed and talked to, they were born and raised here. They may have gone off and done something in their adult
And come
life
back.
and then come back. Yeah. Yeah,
That's
so, I think, future need, help with raising money. I'm sure they'll continue to need help raising money to just provide. We're gonna have to provide clothing, all their bedding. I'm having to buy hospital beds and, furnish the houses so they're comfortable.
mhm.
The Rotary, Sacramento Rotary has donated about $10,000 worth of um, 20 beautiful leather recliners and throw rugs and floor lamps that they've been holding in storage for us. So we have some things like that. But I think just, those things are going to wear out. Clothing's going to wear. I mean, I think there'll be continuous need for things like
Right.
that.
Yeah, that's just that a maintenance part of the operation.
Exactly. Exactly.
Yeah. Well, if people are interested, where do they go to learn more about the operation?
I would say our website, we
Mhm.
try to give all the information on our website about not only current things that are going on, but we have, as I mentioned, an e-newsletter that goes out every other week, and
And can you
that's
subscribe to that on the
yes,
website?
it's free, and you
Great.
can subscribe to it. We have blogs, we have, letters of support from key people like, Doris Matsui, and,
Oh, wonderful.
she was kind of our initial campaign, leader.
Little cheerleader catalyst for
Yes.
you?
Um, and so that's all on our website. So it's www.joshuashousehospice.org.
Okay, and we will put that in the show notes too for anybody. If you're looking on your phone, you can click right through and get to
Right,
the,
right.
get to the website. Dr. Fitzwater, you are truly an amazing human being. And I'm sitting here, I can only imagine how disarming you were to so many people as you came with your cause. This powerhouse of a little tiny woman
Right.
who's coming in and saying, "No, we're gonna get this done."
We're
Uh,
gonna get it
I mean,
done.
how do we say no? Your work in the field of cancer alone is a lifetime of service. That is huge. Your communications institute and provision of what you were doing with the original nonprofit is a lifetime for some people. And here you are starting yet another operation
I
in
have to say, one of the things I'm really proud of is we created the Mother's Wisdom Breast Health Program for Native American women. Who would not go have a mammogram and would not seek prevention because they didn't think that was what they should do.
culturally not appropriate.
Yeah, it was culturally, and so I partnered with an American Indian woman who, taught me a lot about tribal beliefs and about that culture, and together with a group of American Indian women, we created the Mother's Wisdom Breast Health Program, which is still being carried on in tribes to get Native American women to have mammograms and seek preventative care and
Mhm.
treatment.
I'm afraid if we go on, we're going to keep
There's more.
identifying these other things. So if we'd be going for another hour of the
Well, we
stuff that you
could.
originated. Well, realizing a vision of this magnitude with what you're doing with Joshua's house and completing the project I mean, by the time the episode airs, it will be opened. And I understand we may even have some good news by the time this airs with regard to that $1 million.
Exactly.
Go ahead and share that.
Okay. Well, I'm very happy to report that the county, Emily with the county on, has stepped up, and she, in a matter of weeks, has managed to come up with a little over $1 million.
That is so cool.
So, Anthem Blue Cross, she was able to work with them, and we're getting a $400,000 grant from them. And then we're getting over 600,000, I think it's 687,000, from the county, which will give us all the money we need to finish the project and furnish it and have it open before the end of the year.
That's amazing.
It
That
is
is
amazing.
just amazing. And it's so exciting to be here to be able to share that.
Absolutely.
So when people do listen, they'll go, "Oh gosh, $1 million. She's not going to get it. She's not going to make it." And then by the
Right.
time the episode's over,
We will have it,
you
and
got
we'll
the
be
notice
open.
that it came in. Well, giving dignity at life's end for those who are most in need and forgotten and alone is a monumental task and one that deserves a tremendous amount of recognition. So thank you so much for what you're doing, and I cannot wait to see the grand opening of Joshua's house.
I can't wait either. And thank
Thank
you so much for having me on.
Thank you. Thank you for listening to the Nonprofit Podcast Network. I hope you enjoyed the episode. If what you heard moved you, please reach out to that organization and do what you can to help. If you like and appreciate what we're doing to support local nonprofits, please give us a positive review, subscribe, and share. If you're a nonprofit with an interest in participating in an episode, you can reach me at jeff@hearmenowstudio.com. If you have a need for the services or products our sponsors offer, please reach out to them. CapTrust, fiduciary advice for endowments and foundations, Runyon Saltzman Incorporated, RSE, marketing, advertising, and public relations creating integrated communications committed to improving lives, and Western Health Advantage, a full-service healthcare plan for individuals, employer groups, and families. The Nonprofit Podcast Network is a production of, is recorded at, and edited by Hear Me Now Studio.